Hi, this is Paul Barr, news editor with Hospitals and Health Networks magazine. I'm here with Betsy Ryan, President and CEO of the New Jersey Hospital Association. Thanks for being with us here today.
My pleasure, Paul.
What are some of the big concerns that you're facing as a state hospital association CEO?
I would point to three, and I know we're going to talk a lot about the American Health Care Act, but that is our number one concern right now because it will have such a big impact on increasing the number of uninsured in New Jersey, and it will also have seismic implications for our Medicaid program. So that's number one. Number two, and this is happening in many states, there's an increased focus on the out-of-network, the surprise medical bill issue, and it's an issue we've been working on at NJHA probably for close to a decade. So we're in the home stretch of hammering out a legislative solution to that with some key legislators in the New Jersey legislature that will largely protect consumers, patients from surprise medical bills. A third issue I would mention, and it's big in New Jersey, is the property tax issue. You might recall that we were really in the news about 2 years ago with the Morristown Memorial Court decision, where a judge ruled that a not-for-profit hospital would have to pay property taxes. As a result of that, we've been trying to get state legislation to fix it, unsuccessful so far. As a result of that, we have about 40 of our 59 not-for-profit hospitals currently being sued by their towns. And that's just wrong. So we're trying to work on a statewide legislation to solve that issue.
How long do you think that might take?
It will take a while because it's difficult for me to get my state legislative leaders and Governor Chris Christie all on the same page. They all have varying approaches, but we're plowing through and pushing them.
What about Medicaid? That's also looming, possible changes. What's going on with that?
Well, we're now focused increasingly on the Senate. In New Jersey, we were able to have 3 of our House Republicans vote against the American Health Care Act, and we're very appreciative of our congressional delegation. All of our Democrats were off the bill, and we got 3 Republicans to vote against the bill. Medicaid will be devastated if the per capita caps move forward. CBO has estimated that we will see $880 billion removed from state coffers. It will leave a huge hole in the New Jersey state budget because of the loss of federal funds. And state hospital executives know that in 2020, when the federal funding goes away, states can't afford to fund that program. So the increases we've seen in the insureds will erode and our uninsured will just go through the roof. In New Jersey, that's well over 500,000 individuals who have been enrolled through the Medicaid expansion.
I imagine that's attracting the attention of hospital CEOs.
Absolutely. That's why it's our number one issue.
Also, I understand there's some activity taking place in terms of working at the top of professional licensure in the state.
I think it's an increased focus that many of us are looking at as we face physician shortages, and we're lucky in New Jersey. We have a couple of new medical schools that are training the doctors of tomorrow. But increasingly, I think we're going to need more physician assistants and nurse practitioners. We also need to look at the scope of practice law in our individual states to make sure they're doing the most they can do under their professional training.
Thanks for being with us here today.
You're welcome.
For H&HN, this is Paul Barr. Thanks for watching.